Welcome back. We're helping you stay on track with your health today, and we are focusing on prostate health. Here with more is Dr. Balandra of Naples Urology Associates. So great to have you on the show this morning.
Good morning. Thanks for having me.
We were kind of talking about prostate health and prostate cancer, and this can be kind of some silent symptoms sometimes.
Sure.
So what do we need to know about keeping our prostate healthy?
Well, so the prostate is a gland obviously pertaining only to males, right? So only males have it, but that's half the population. And its function really has to do with reproduction. So it secretes certain things that are needed to have kids. But the problems are seldom because of that function. It actually just, the problems arise from two reasons. One, prostate cancer. You know, cancer can happen to, anyone. I get a lot of patients sometimes, when they have the diagnosis, they're like, well, what could I have done differently? And a lot of times it's, just don't kind of think about that, don't blame yourself. But before that, before getting there, it's staying healthy, so the usual things, so eating well. In regards to the prostate itself, there are certain things with urination that are important, and I can tell you about the function of the prostate and where it is, so that you can imagine why people have urinary problems. So I can give you a little.
Please do, yeah. You
got it. So basically, the prostate is it's a walnut-sized organ. Okay, so it's about this size, a little bigger. And it happens to be right in between where the bladder is and then the outside world. So as we sit here, and any of the males over there in the audience sit here, the urine is being made, it sits in the bladder. But when they want to go to the bathroom, the bladder squeezes and it has to come out, the urine has to come out through a little tube. That tube tunnels through the prostate. So something that is very common is that the prostate can grow, and as it grows then, that tube becomes narrower. Okay. So it's difficult for people to go to the bathroom, and they start having some symptoms.
So that's really where you'll maybe kind of notice and try to pay attention to those bathroom habits.
Correct.
And if you notice some problems, obviously probably a good idea to talk to your doctor and talk about what's going on. If you do go and see a doctor, what can a urologist do? What is this
so first thing,
like?
Talking about the prostate cancer part, we're gonna make sure that we talk about the family history, because that's important. If you have a family history of prostate cancer, so father, brothers, cousins, things like that is an important part. Second is a blood test.
You can blame your family, right?
That's right. Yes, sometimes you can. Exactly. You'll be like, that's what it was. But blood test, okay. So there's a simple blood test that can be done, and it's in a particular population, so we make sure that we screen the right patients. And then a physical exam. So the physical exam, we actually feel the prostate and see if there's any areas that are concerning. So that's from the part of the prostate cancer. And hopefully, if you don't fit the category of concern for prostate cancer, then we talk about the reason that brought you in, which was probably the complaints of I'm waking up a lot at night, whereas before I could sleep the whole night. Right. Or I'm standing there in the bathroom, nothing comes out, or I'm going every 3 times during the movies, things like that. So then we focus on that area, which is the quality of life part. And there's a lot of things we can do to help people that have those issues.
And with urology, Naples Urology Associates, you guys have multiple locations, but you pretty much span from Bonita to Naples, right? If somebody wants to come in and see you.
So basically, I mean, Bonita, I do have a lot of patients from Estero and Fort Myers that just, it's a short trip on 41, and then obviously Naples. So we're able to see them everywhere. And, and the population here in Southwest Florida, as you know, it's a very seasonal population, but also there is a lot of older people. And this issue of the prostate affects mostly older men. Okay. And both for the prostate cancer as well as the urinary symptoms. But also, I mean, we in your earlier segment, we had a musician, and something that the patients complain a lot is when they come here to Southwest Florida, they're either coming for the season or just because they're retired or they want to enjoy the beautiful lifestyle here. And problems with the prostate really affect that enjoyment, because if you can't stand through a movie, you can't go to the theater, you can't go to dinner. I mean, it's a big deal. So whereas people tend to believe and feel, well, I can get used to things, you don't have to. And that's the thing. I mean, that's why I actually went into the field of urology, because I think it's such a thing that it's taken for granted, the urination and going to the bathroom, but it's so important. And sometimes can be easily fixed. It's not something you have to absolutely live with.
Well, as we close here, should they go to your website to learn more, or if they need to make an appointment, what do you suggest that they do? So
basically, the website's a great resource. It has the phone numbers. Just call, make an appointment. And then the phone number is there. Obviously, you can always access that.
Thank you so much.
So you got it.
Great to have you on the show.
Thank you very much.
If you'd like to learn more, be sure to head online to our website. We'll have everything the doctor talked about at fox4morningblood.com.